I'm excited about sharing my story, and I really want to help other women listen to themselves and then feel comfortable with sharing their questions and concerns. So as I think about when did everything start, I go back to going to my primary care physician. I was thinking that I was just getting closer to menopause, so my periods were starting to go off a little bit, so we kind of decided let's go in and do some blood work. It kind of was the cascade of events that eventually got me to an ER visit. Because of that, I continued to look for other resources, and when I shared this with my primary care physician, she recommended that I see Dr. Kissane.
When I first met Fatma, she was a very warm person, and I was immediately drawn to wanting to help her and figure out, what was going on with her. We ordered some additional tests and kind of started with the most conservative measures to make sure we didn't miss anything, and then just kind of went down this journey of additional testing to find out if there was anything functional going on with her pelvic floor.
It was great to get both teams, as well as our pelvic therapy team, to all talk about it and see what are the next steps. That's when we started talking about the surgery.
We decided to operate robotically because there were some upper colorectal abnormalities as well as very distal pelvic floor vaginal wall abnormalities. We were able to do a combined surgical approach involving myself, the urogynecologist, and a colorectal surgeon, Dr. DeBesh.
I was only in the hospital for just one night. I'm just back to the recovery period, and I feel a lot better.
So if a woman is experiencing difficulty evacuating bowel movements, pelvic pressure, feeling of a vaginal bulge, or a general discomfort in the vaginal and pelvic floor area, that's a time when it's probably important to talk to your OBGYN, talk to your primary care doctor about the possibility of seeing a urogynecologist. It's more common than most people could imagine, and many, many women deal with pelvic organ prolapse, urinary incontinence, and bowel difficulties. And so being, bold and seeking answers and not being embarrassed to talk about them with your provider is probably the most important take-home message that I can see here.
One of the things that I learned during this process is you should put yourself first. Even if you're taking care of your family, you're taking care of your patients, for our profession, or taking care of your friends, you should come first. You have to make sure that you have good energy and good health to be able to help others or be a good resource for others too. Right now, I feel a lot better, a better human, a better person because of this, not despite this. So I really, it's almost like it was a life-changing experience in many ways.